Hello, my name is Tamas Szakmany, the Associate Editor for Social Media at Critical Care Explorations. Here are my top reads from the journal this month. Let's start with a new approach piloted in multiple US centers targeting the removal of SARS-CoV-2 particles from the bloodstream of critically ill patients. Chitty and colleagues from the Purify Consortium used a commercially available blood purification device to achieve this, and in their retrospective observational study reported that the treatment was safe and well tolerated. In their multivariate analysis, there were pointers towards better outcomes. They concluded that the Seraph 100 microbind affinity blood filter should be evaluated in larger randomized controlled trials as a complementary therapy for COVID-19. Comsty and colleagues from the United Kingdom presented an important meta-analysis on a fundamental question in critical care. What oxygen targets should we be using in our patients needing mechanical ventilation who are in need of high inspired oxygen? The 8 studies of almost 4,500 patients indicated that the highest mortality was attributed to the highest oxygen targets. However, the certainty of this finding was very low. There were no significant differences in any of the secondary outcomes, and the authors argue that these results should set the baseline for further, higher quality, and more robust RCTs to investigate this question. The risk of AKI in trauma patients is high, and conventional markers are often late to diagnose the issue. In an observational report, Dr. Faust and her colleagues evaluated the role of 3 plasma nucleic acid damage-associated product kinetics to better describe and prognosticate acute kidney injury following trauma. They found that the 3 different DAMPs have a time-sensitive variability in their predictive values, and they offered a mechanistic insight into the development of AKI. They concluded that the 3 markers could also be looked at as therapeutic targets in future studies. Please take time to read these articles and more by visiting ccejournal.org. Also, follow us on social media at CritCareExplore. Stay safe, everyone. Thank you.